Hello everybody. This video is for any medical students that's studying for the USMLE exam, whether it's been step 1, step 2, or step 3. My name is Dr. Adesina. I'm the director, CEO, and founder of SmashUSMLE.com. I would like to share some of the secrets that I found that's been very, very useful for any medical students that are studying for the USMLE, and some of the secrets that I actually used to study for my boards, did extremely well, and now today I'm an emergency physician. Now, being a medical student is hard, and I know that, and I'm sure you know that too. And taking the USMLE is one of the most daunting things as a medical student, and it's very important that you use the right resources and understand how the exam is written and why it has that level of difficulty and why it really is important for you to do well on the exam. So I'm going to share you some basic secrets of what you need to know and how you need to have an intense focus on how to do well on this exam. First, you complete your first 2 years of medical school, or you're an international medical graduate who has already completed medical school or has a degree from a different country coming to the U.S. to study for the USMLE. You know the USMLE is the United States Medical Licensing Exam offered by the NBME, and it's very, very crucial for you to match into residency. Getting to residency has become more and more difficult over the last few years because the competition is more fierce, there are more applicants, and the expansion of medical schools and the demand for more physicians to be graduated into the healthcare system is ever more increasing, which means that you as an applicant, you as a future physician, need to work extra hard to be able to get a higher score to match into residency that's used to even become easier to get into. This is how I look at the USMLE. It's like getting married. Everybody wants to get married, and it takes a lot of preparation to get married. But you only want to do it right the first time. Now, the first thing you need to know is the content of the USMLE is so massive, but it is not impossible. Here are the first resources you must have if you're studying for the USMLE. You must have First Aid for the USMLE, the current edition, and I'm going to tell you how to use this book. First Aid was written by the authors, Tao Li and his other authors. And the idea was to grab all the minute details that can be tested on the USMLE and let's put it into a simple book that everybody can use to study. What they forget to tell you as the student is that it is not a medical textbook. If you pick up Robbins' Pathology, you can literally read the content verbatim and understand the words as they're written in the lines. However, if you pick up First Aid, you kind of get lost, right? Yeah, there's a reason for it. It is not a medical textbook. You cannot fit all the content of medicine into one textbook. However, we can take little key points and put them inside a whole book, and it has multi-layers levels of understanding before you can even get one single concept. That is how the book is really organized. So stop wasting your time picking up the book and reading it the very first time. It's not going to work. What you really need to do is you have to cut off the edge of the book and go to either a store and have them put it inside a 3-hole punch binder. What that does is it loosens the pages of the book and allows you to have more flexibility. This is exactly what I tell all my students. Now, once you have done that, the next step is use our question bank. We have a 2,300 USMLE Step 1 question bank. We also have over 2,000 USMLE Step 2 CK questions that actually follow the NBME format using the exact same format you're going to see on the exam day. So using our question bank gives you a hedge above all other students because you are not familiar with exact USMLE format. The questions are written out of First Aid and other medical textbook. Now, you have to start doing questions first. Now, it sounds counterintuitive because all your life, you've been told you go to class, somebody regurgitates the material on a board for you at a PowerPoint, and then they tell you to go home and read that content, come back in a week or two, and let's test you if you knew the material. Because that concept has been ingrained into your understanding, you don't understand how standardized exams are. A standardized exam is a multi-level integrated content that try to test you at multiple levels of different clinical scenarios on the same topic. And I'll give you a basic example so you can see exactly what I'm talking about. So the first thing you really need to do is pick up the question bank. And I know it does not make sense. It defines the law of studying because you're not used to that. Doing questions forces you to see how we are going to test you on the material. You know why? Because it doesn't matter what you already know. There's a way we want you to know the concepts. Let me give you a perfect example. We give you a 3-year-old Caucasian male that's coming in with a history of fevers, productive yellow sputum for 3 days. They said the patient on physical exam, you know that is tachycardic, shortness of breath, wheezing, and has a salty tasting skin. I know what you're thinking. I know the answer to the questions. It is cystic fibrosis. You're like, yes. I'm the physician writing the questions. I know you know that. You think I'm stupid? That's not what I want you to know. And then the question further says, which of the following antibiotic will be able to treat this patient's most common organisms? And I just twisted the questions that you initially thought was cystic fibrosis, which you notice that it is, but the most common organism is Pseudomonas. But when you look at the options, Pseudomonas is not going to be there. It's going to be amoxicillin. You're going to see metronidazole. You're going to see, and then you're going to see piperacillin, tazobactam, and then you're going to wonder, piperacillin, tazobactam, that is the antibiotic we use to treat Pseudomonas. Yes, that is absolutely correct because I want to test you on microbiology of cystic fibrosis organism, and that is how we want to test you on it. See how I changed the question that you initially thought, salt tasting skin in a Caucasian male, coughing up productive sputum, it is cystic fibrosis? Yes, but that's not how I want you to understand the question. I want you to understand everything about that disease. I can test you on the biochemistry, the genetics, the pathology, and I can test you on pharmacology of the same disease in different angles. That is why first aid is not a book. So when you start doing questions, you're going to see a pattern. There is a pattern, guys. Do not miss it. It's the same concept. The content they're going to test you on is limited, all right? But they're going to test you on different topics on the same topic. So you have to master, not only just master, understand mechanisms of disease processing, mechanism of action of diseases, mechanism of action of drugs, side effects of medications, organisms. And it's really that simple. Now, once you start to do questions, right, set them even in tutor mode the first time, because who cares what you do? For example, you're going to do the questions and you're going to score 20% on the question bank, and you're going to cry, and that is normal. I cried when I used to do my USMLE questions. I said, Jesus, why am I getting 20 or 30% on the questions? I thought I knew the information. No, you do not understand how we want you to know it. And repetition is the mother of all learning, the father of action, and the architect of all accomplishment. So, first, go through a question bank. As many questions as you can. If you get through 2,000 questions, 3,000 questions, the questions repeat themselves after a while and you start to see the patterns. And after you've done a question, highlight and look at the correct and incorrect answers. I see students who make this mistake all the time. They'll read the question, they pick the answer, and they're like, oh, I almost got it right. Who cares? You want to get it right on the exam, not on your practice. Okay? Now go back, read each question, read each answer, read all the correct and incorrect answers. This is important. Read all the correct and incorrect answers and go back in this book, okay? Go back into first aid and find where that question came from. And start making little notes on the side. Have extra pieces of paper. Do that over and over until you finish the question bank. By the time you're done with the question bank, your first aid is going to become a book. It's actually going to become so repetitive, you will have ripped the pages and fill the pages in your hands and master almost all the content on each page. After you've gone through the question bank and went through the book, now you can start reading first aid. You know why? Those little notes that you've written has turned this book into an actual textbook. Now the words are going to jump out into the page. When you see TSST1, you're like, yes, I understand what TSST1 in the Staph aureus toxin is. All right. When you see a patient with lupus and you read the lupus chapter, you're going to understand, yes, I understand lupus. I know it's like antibodies binding to DNAs, right? I understand why now they have pericarditis. I understand why they have arthritis, right? I understand why they have the malarash, not just memorization. That is the secret, guys. Now, you are going to need multiple books to supplement first aid, but first aid will be your Bible. Now, if you don't understand neuroscience, pick up Dr. White's neuroscience book and read it. Understand it. Take little notes. Do questions that are related, and then add those content into your first aid. That is your primary book. If you don't understand biochemistry, pick up a little biochemistry book and don't read it. Read only what you need to know. You spot read the content that you don't understand and put it back into the book. All right. If you don't understand behavioral science, pick up a good behavioral science USMLE review book and do the same thing. And this is how you're going to eventually develop your own textbook and turn this book into the ultimate book you really need to make it into. Now, after you've done that, you want to test yourself. You want to look at the NBME questions. What do I mean by the NBME questions? So the NBME has a whole database of question banks that they offer as an assessment test. So you wonder, what do you mean it's an assessment test? Do I really need to do the assessment test? Yeah, absolutely. I've had a chance and opportunity to meet the people from the NBME and ask them these questions, and I said, listen, why don't your NBME questions have correct and incorrect answers? And I'll tell you that in a minute at the end of this video. Just keep watching. So, the NBME has sets of questions that have been tested. Do you know what an assessment test is as a USMLE candidate? Well, let me tell you. An assessment test means that you and everybody else has been studying and try to master content. And at the end, I want to assess your clinical knowledge of how much of this information have you really understand and actually be able to answer these questions based on your level. So let's pick a random number. Let's say the highest level of assessment in terms of your knowledge skill should be at 100. If you have 70% knowledge of the content that you need to know, you've mastered 70%. Anytime you take these assessment questions, you are not going to score more than 70%. You know why? Because we have tested it over thousands and thousands of students that have taken the USMLE, and it's proven over and over again that if you only know 70% of this content, this is only 70% of the content you can answer. You are not going to be able to answer the rest, even if you keep guessing. That is an assessment test. It tells you, are you ready for the test? And this is the range of what you're going to score in the real exam. That's scary, right? It's like looking at yourself in the mirror. But I see students every year take the USMLE assessment, and the assessment is painting the picture of what they're going to score on the real test. And they're like, oh no, something is going to happen on the exam day, and I'm just magically going to score 240. When you're scoring 210s on your assessment test, and let's say you wanted to do dermatology or you wanted to do something competitive, anesthesia, and you're, I scored 205, but I know by Tuesday in 3 days, I'll be ready, and let me just go and take the test because I'm going to score 245 because that's my dream score. No, you're not going to score 245 on the exam. The assessment test tells you this is the range of what your score is going to be, and that is exactly what it is. So after you've studied the material, done multiple question banks, read your first aid multiple times, at least 3 times, read your Goyen, incorporate content, and you've done enough question banks and done the questions bank again and again. Then you take an assessment test, and let's say on this assessment test you score 235. It's going to give you a range. It's going to tell you on the real exam you might be between plus or minus 10, which means you might score between 225 and 245. Most of the time your score might go up a few points or come down a few points. But you're going to stay within that range. You maybe score 238 or 232 or 230. But that's the fact. But students every year ignore it. Every single year, I gotta go take the test, I'm running out of time. No, you're not running out of time. You're about to hurt yourself. Okay? Remember, you only get one shot at this exam. If you pass the test, you can never, if you score 199 on the USMLE, you will never be able to take that test again. You're stuck with your score. If you fail, which I don't want you to, you get a chance at it again. But failing is not good. It's such a hard exam to study for. It takes weeks and weeks and weeks to study for, sometimes months, for you to blow it. So I'm trying to teach you things to do so you do it right the first time. And I know you can. You take the assessment test, take the latest one, okay? Take at least 2 or 3 of them to give you a good assessment of how you're going to do in the exam. And if it's between a week before your test, take the final one, which is the latest one that they come out with, and see how you do. If you're still scoring 235, 240, 245, if that's your score, if you just want to score 220, if you just want to score 210, as long as you're hitting your average of what you want to be, then you can live with it. Then you can be happy. Some students want to get 260. Some people just want to get 200. Some people just want to pass. Whatever your dream score is, whatever your aim is, as long as you are hitting those goals with those assessment tests, you, my friend, you are ready to take the USMLE. Now, some students say, do I really need to watch videos for the USMLE? The question is yes and no. Now, videos, review videos, which we have on smashusmle.com, over 250 hours for step 1 and step 2, allows you to review the content you've forgotten. And this is what I've learned about videos. They help you solidify and also quickly review the things you don't understand. On smashusmle.com, for example, the video, you can speed it up to 2 times the speed. So if it's a 30-minute content on glycolysis, you can watch it in 15 minutes, which means in 15 minutes, you just mastered everything they taught you in 2 hours of glycolysis lecture in medical school. That it's only relevant to what's only tested on the USMLE and the pathways, the enzymes that you really need to focus on. Okay? And that just saves you some time. So the next time you do questions, you can easily answer them because you remember it. That is where videos come into play. Some students need to watch all the videos. Some students need to watch half of the videos. Some people just need to review the videos to kind of help them solidify the content. If you're weak in behavioral science and you don't understand behavioral science, you've read a book, watch a video. Learn about incidence, prevalence, sensitivity, specificity, positive predictive value, negative predictive value. It's all over the entire exam. You know why? Because in medicine, we read journals. We read articles. And when you read articles and trials and studies, it's all in those papers. That is how you're going to understand if they have a p-value that's less than 0.05. What does that really mean? Okay? So you want to understand the sensitivity of the test and the specificity. So if they're telling you and you're reading a journal article, that is where it's really applicable. But when you're a medical student or medical school, that is a hard concept for you to understand. But when you become a physician in a clinical practice, when you pick up an article in a journal and you read a study or a randomized control trial, that is how you're going to understand it. That is why it's extremely important on the exam. Okay? So here's my secret. And when I talked to the NBME, I was at a conference and I met the NBME and I said, guys, students are always complaining about not having the score, the answers every time they take the NBME, and this is the answer. We do not want to turn ourselves into a question bank company because there's a fine line between us as the NBME body, okay, the National Board of Examiners, offering you questions, and also other question bank companies that are out there, and that's the reason why they don't give you those answers. And I know it's very frustrating, and they know it's frustrating for you to take a question and you don't know the correct or the incorrect answers. But remember, it's just like just looking at yourself in the mirror. They just want you to know what you know. And that's it. That's their goal. If you want to know what you don't know, go back to smashusmle.com and do the questions. We'll give you the correct and incorrect answers, and you'll be able to understand the concept. And then you can go back again. Now, tips for the exam day. A day before the exam, please do not go out drinking alcohol or getting drunk or try to party. You can go watch a movie. You can go do anything else other than things that can make you intoxicated. Get some good night's sleep. I'm going to promise you, you're going to read, you're going to know a lot, but you're not going to know everything. We're going to know enough for you to get your dream score. And once you get to that place, it's okay to let go. You can go and now take the exam. All right? get some good fruits, stay hydrated, good sleep. It's a long journey ahead. It's an 8-hour exam. You're going to do it multiple times, but you can do it because many people have come before you and many have gone after, and many are still coming after, long after you're gone taking this USMLE exam. Do not let this test define you as a physician. I have taken it all. I've taken USMLE Step 1, Step 2 CK, to COMLEX Level 1, Level 2, Level 2 PE, Level 3, okay? Taking my oral boards and written emergency medicine boards. I've taken them all. And I'm here standing here today telling you you can do it. And this exam have not defined me as a doctor because you are more than the USMLE. And I believe you can do it using the right strategies and being dedicated, focused intensity, using a schedule. We have one on smashusmle.com. You can download for free, okay, to study, and prayer and a lot of encouragement. Thank you for watching this video. If you want to do very well in the USMLE, I invite you to come use our test prep course, smashusmle.com. We have an app that you can download and you can watch your videos anywhere on your iPad or your iPhone, on Android. Okay, you can download the app. Just go to the App Store. You type in Smash USMLE either on your Android or iOS, and you can use a free trial even for 15 days where you can watch free videos and lectures and questions and try it out. Okay, this is the next revolutionary product in the market, and it's going to extremely help you. And my team and I spent thousands of hours to develop a curriculum to help you succeed on the USMLE. And if you use it, if you fail, we will give you your money back. Okay? All right, that's our test guarantee for our USMLE test prep. Thank you for watching. Go now to www.smashusmle.com and register today. Thank you for watching. Have a nice day. Bye-bye.